A tumor is a bag your body built to hold toxins. Cut into it with a biopsy needle, and you burst the bag and spread the cancer. That claim went viral again this month, and people are declining biopsies because of it. I'm Michael Merth, a registered dietitian who spent years in oncology nutrition. This one is not a gray area, and I'll show you exactly where it comes apart. Let's start with why this feels believable, because it does. The idea comes from a real intuition. Your body does wall things off. It builds an abscess around an infection. It builds scar tissue around a splinter. Containment is genuinely something your body does. So when someone tells you a tumor is a container the body built on purpose, that maps onto something you already know is true. Then add the fear. Nobody wants a needle in a mass. And the myth arrives right at the moment you're most frightened, and it offers you an exit. You don't need the scary test. The test is the danger. That's the whole appeal, and it's why this claim keeps coming back. Here's the sliver of truth, and I want to be fair about it. There is a real phenomenon called needle tract seeding. When a biopsy needle is withdrawn, it is technically possible for a small number of tumor cells to be dragged along the path the needle made. This is documented. It's in the literature. It is not zero. Now the number. Across the studies, needle tract seeding is estimated at well under 1% of biopsies, and for most cancer types the estimate lands in the range of 0.1% to 0.1%. It's rare enough that surgeons plan for it anyway. When a tumor is removed, the biopsy tract is often excised right along with it. And it's rare enough that no major cancer organization anywhere recommends skipping biopsy to avoid it. And the number keeps falling as the tools improve. A 2024 meta-analysis in BJS Open pooled 23 studies and almost 9,000 patients getting liver biopsies. It put the seeding risk near 1%, down from about 2.7% in older data. The reason is technique. Modern coaxial needles carry the sample out inside a sheath instead of dragging it back through open tissue. So, the one real version of this risk is small, well understood, and getting smaller every year. Now the claim itself, and it's wrong at the level of what a tumor is. A tumor is not a bag. It is not a container. There's nothing inside it to spill. A tumor is a solid mass of your own cells. Cells that acquired mutations, stopped responding to the signals that tell a cell when to stop dividing, and stopped dying when they should have. It's a crowd of cells, all descended from one original cell that went wrong. Under a microscope, it doesn't look like a sac holding poison. It looks like tissue. Ask the toxin-bag believer a simple question. What is the toxin? They never name it. There's no compound, no assay, no measurement. Real biology names its molecules. This one can't. And here's the part that ends the argument. Cancer does not spread because you poked it. Cancer spreads through metastasis, and metastasis is a process that starts long before anyone touches you. Cancer cells break away from the primary tumor, invade the bloodstream or the lymphatic system, survive the trip, and then colonize a distant organ. That process requires an entire cascade of acquired capabilities. It is happening or not happening based on the biology of the tumor, not on whether a radiologist took a sample on Tuesday. If tumors were sealed bags, metastasis could not exist. But metastasis is the thing that makes cancer lethal. The myth and the disease cannot both be true. So what does it actually cost to refuse the biopsy? Everything downstream. The biopsy is not just confirmation that cancer is there, it's the document that tells your entire team what to do. The pathology tells you the type of cancer. It tells you the grade, which is how aggressive the cells look. It tells you the receptor status. Whether breast cancer is estrogen receptor positive or HER2 positive changes the entire treatment plan because there are drugs that only work on those targets. It gives you the molecular markers that decide whether you're a candidate for targeted therapy or immunotherapy at all. Without the biopsy, none of that exists. Your oncologist is guessing. They cannot stage you properly, they cannot pick the right drug, and they cannot enroll you in a trial. So look at the trade honestly. On one side, a risk of needle tract seeding measured in fractions of a percent, which surgeons already plan around. On the other side, a treatment plan built on a guess. There's a real chance you get the wrong therapy for the cancer you actually have. The delay is its own harm, because tumors keep growing while you decide. So here's what to do. If you're scared of the biopsy, say that out loud to your team. Fear is a normal response to a needle and a diagnosis, and it's worth naming. Ask them how they'll approach the tumor, whether they plan to excise the tract, and how they'll use what they find. A good team will answer all three. Ask what the pathology will change. The answer is almost always everything. Which drug, which dose, which trial, which surgery. And if the toxin bag idea reached you from someone you trust, don't fight with them. Ask them the one question. What is the toxin? Watch what happens. A tumor isn't a bag of poison your body built. It's a crowd of your own cells that stop listening. And the biopsy isn't what spreads it. The biopsy is how your team learns how to kill it. Have you seen this claim in the wild? Tell me where in the comments. And if you want the guide to understanding your own blood work or